Louisiana, and certainly ask for your support.
Our question on the bill, Representative Gary Carter.
Thank you, Mr. Speaker. How do you define able-bodied persons?
Well, people who are, that's speaking of those who would be able to follow this and to work, so they would be physically and mentally capable of doing whatever it is you're asking them to do.
No. I'm not asking you to define it or look at a dictionary. I'm looking at your legislation, and I'm looking for the definition of how this bill defines able-bodied person.
Well, I'm not sure if I can answer that question. Are you looking at a
So
particular
you have
place?
legislation that's going to say, I guess the accusation is that there are able-bodied individuals who are taking advantage of the Medicaid program, and they should be working. That's how I read this legislation. Is that a fair reading of it?
If they're under Medicaid, they're qualifying for Medicaid, and they may be able to work but just don't have a job, we're just going to try to help them go do that.
But so able seems to have become a term of art. And if I'm a lawyer and I'm looking at a term of art, able-bodied, I can't look at this legislation and say, this is how we define it. How does this bill define able-bodied, or do we have to rely on the subjective belief of someone else to determine when someone may or may not be able to work?
If they're not able,
defined by
will
whom?
it not apply?
Defined by whom? How do you define
Well,
able?
again, LDH is going to put this is asking them to put this into place, so they'll have to define that during that time. It's not, if it's not here now, then, but I think it's a common sense answer to that if you're able-bodied. And there are many issues in which I read every one of them that would make people not have to apply for them because they have health issues or other things that I mentioned when I read those out a minute ago.
Well, there are certain waivers involved that will require a note or something, some sort of report from a medical physician. And it's my understanding that if a medical physician is needed to help determine whether or not someone is able-bodied to work, it may not be a matter of common sense, one. And my additional concern, did you know, is whether or not there's the subjective belief out there, subjective disagreement of whether or not someone may or may not be able-bodied.
I don't know the answer to that.
Well, let me ask you a bigger question.
Okay.
What does this have to do with the fiscal crisis that we're facing today?
Well, that's also, we're not sure about the cost, but if you, it will not go forward if we don't have the money to do it. In fact, if you look at the fiscal note, it says before implementation, a plan must be reviewed and approved by both the House and Senate Health and Welfare Committees. An approval plan would then require an appropriation bill through JLCB or during the budget process based on the implementation date. The bill further requires the Secretary to implement an improved plan in the most cost-effective manner. Ultimately, the program design will dictate actual cost. If it's going to be too expensive, it may never get in place.
You know, that's interesting, because I was actually thinking the opposite. You're trying to figure out, and we don't know, how much this program will cost the state of Louisiana, and we don't know the answer to that, right?
We do not.
But what does this bill do to help us either generate the monies we need or make cuts to services that perhaps other may say is discretionary to help us deal with this $994 million fiscal cliff we're dealing with? What does this legislation have anything to do with the fiscal cliff we're facing?
In the Montana plan, and that's just an example, I mentioned there are other states looking at this, and the Montana Health Plan, and they don't remove people from Medicaid either. And again, I'm going to say we're not moving people from Medicaid. But in that plan, it's been very successful, and they have less people on Medicaid because they are now working, and they're making an income, and they're paying taxes. So it actually makes more money come into the state through the taxation process we've been working on for a couple of weeks now. And it just makes everything better, and it makes it certainly better for those people. But again, if they're not capable of that, we don't expect them to do it.
Will REC recognize any revenues from your bill to help us deal with the fiscal cliff for fiscal year 18-19 from this legislation?
I'm sorry, I don't understand your question.
Will there be any revenues recognized from your bill to help us deal with the fiscal cliff we're facing for fiscal year 18-19?
Well, if it got to get that fast, I hope it would. It may take longer before it does that. But again, number one, as I said again, we're not moving anybody from Medicaid. Number two, we're trying to make their lives better if they're able to work and we can help them go to work.
I'm looking at House Bill 23 by Representative Stephen Dwight, and I realized on page 34, line 8 of his bill, his legislation on House Bill 23 is contingent on this bill passing, this Medicaid work requirement legislation. I don't see the correlation whatsoever between our fiscal cliff we're facing and these Medicaid bills, your bill, Bacala's bill. I don't see the correlation at all. And it's almost as if you're holding the poor people of this state hostage that, listen, to vote for these taxes with House Bill 23, we're going to force people to also vote to, one, have the legislative auditor have access to Medicaid recipients' tax returns, and two, start putting in some work requirement for the poorest people of this state. This is a bad bill. I ask that we vote against it. Thank you, Mr. Speaker.
For a question on the bill, Representative